When I started SAPHNELO, I didn't know what to expect, but it has really helped my lupus from the moment I noticed it was working and still to this day. This has been a game changer for me. My name is Lynett Marie, and this is my SAPHNELO story. Lupus can affect everyone differently. For me, I developed canker sores, was tired all the time, and my hair was falling out. I was having difficulty walking, and I was in and out of the hospital often due to severe flares. And my doctor knew we needed to change my treatment plan quickly. When my rheumatologist introduced me to SAPHNELO, I remember him saying it was his first time prescribing it. But he was willing to see if adding SAPHNELO would help me with my lupus. After discussing the potential benefits and risks, I said, let's do it. And the following month, I started SAPHNELO. Infusion went very well, had to take the treatments every 4 weeks. By the third treatment, I was off steroids and up walking around. I've been on SAPHNELO for almost 2 years now, and I'm doing excellent. My lupus and quality of life have improved, especially since I've had fewer flares. The rash on my face has faded, my hair is growing back, I'm not as fatigued as I used to be, and my mobility has improved. In fact, a friend and I were at a restaurant, dancing, moving, grooving together, which really helped me feel like myself again. One of the greatest challenges for me prior to adding SAPHNELO to my treatment plans was the steroids. While I'm on other medications, I'm happy to say that steroids are no longer a part of my daily routine. You know, when my lupus was at its worst, I can just get up and go like I used to. Adding SAPHNELO to my treatment plan, along with my other lupus medicines, has reduced my disease activity. Now I've been able to get back to the one thing I love the most, and that's traveling the world. Whether it's visiting family in other states or going on trips with my friends. Knowing I can confidently be spontaneous like that again makes a huge difference. This journey really put things into perspective for me. I began to realize what's really important to me, like being around loved ones, inspiring and uplifting others, just being the best person I can be. That's what I want my legacy to be. Whatever time I have left here on this earth, I want to make sure that any person that has lupus knows about all the options they have and that they get the care and treatment that they so sorely need that they don't get. This is my story. If it's able to help anyone else, then I've done what I came here to do.
Important safety information. Contraindication. SAPHNELO is contraindicated in patients with a known history of anaphylaxis. Warnings and precautions. Serious infections. Serious and sometimes fatal infections have occurred in patients receiving immunosuppressive agents, including SAPHNELO. SAPHNELO increases the risk of respiratory infections and herpes zoster. Use caution in patients with severe or chronic infections. Avoid initiating treatment during an active infection, and consider interrupting therapy in patients who develop a new infection during treatment. Hypersensitivity reaction including anaphylaxis. Serious hypersensitivity reactions, including anaphylaxis, have been reported following SAPHNELO administration. Events of angioedema have also been reported. Other hypersensitivity reactions and infusion-related reactions have occurred following administration of SAPHNELO. SAPHNELO should be administered by healthcare providers prepared to manage hypersensitivity reactions, including anaphylaxis and infusion-related reactions if they occur. Immediately interrupt administration and initiate appropriate therapy if a serious infusion-related or hypersensitivity reaction, such as anaphylaxis, occurs. Malignancy. There is an increased risk of malignancies with the use of immunosuppressants. The impact of SAPHNELO on the potential development of malignancies is not known. Immunization. Avoid the use of live or live-attenuated vaccines in patients treated with SAPHNELO. Use with biologic therapies. SAPHNELO is not recommended for use in combination with other biologic therapies, including B-cell targeted therapies. Adverse reactions. The most common adverse reactions, incidence greater than or equal to 5%, are nasopharyngitis, upper respiratory tract infections, bronchitis, infusion-related reactions, herpes zoster, and cough. In the controlled clinical trials, the incidence of infusion-related reactions was 9.4% in patients while on treatment with SAPHNELO and 7.1% in patients on placebo. Infusion-related reactions were mild to moderate in intensity. The most common symptoms were headache, nausea, vomiting, fatigue, and dizziness. Use in specific populations. Pregnancy. A pregnancy exposure registry monitors pregnancy outcomes in women exposed to SAPHNELO during pregnancy. For more information about the registry or to report a pregnancy while on SAPHNELO, contact AstraZeneca at 1-877-693-9268. There are insufficient data on the use of SAPHNELO in pregnant women to establish whether there is drug-associated risk for major birth defects or miscarriage. Advise female patients to inform their healthcare provider if they intend to become pregnant during therapy, suspect they are pregnant, or become pregnant while receiving SAPHNELO. Lactation. No data are available regarding the presence of SAPHNELO in human milk, the effects on the breastfed child, or the effects on milk production. Pediatric use. The safety and efficacy of SAPHNELO in pediatric patients less than 18 years of age has not been established. Please see full prescribing information, including patient information, at www.saphnelohcp.com.
Learn more about SAPHNELO for your adult patients with moderate to severe SLE at saphnelohcp.com.